Diastasis recti and how it affects your pregnancy. So we've already talked a lot about how diastasis is common during pregnancy, and the reason is the connective tissue that runs down the center of your abdominal wall is affected just like the connective tissue and the ligaments of your pelvis with that relaxin hormone. The relaxin hormone that makes your joints stretch and room for the baby also makes the connective tissue a little bit more loosey-goosey so that there's room for the uterus to grow. That combined with the ultimate forward forceful pressure of the growing uterus really makes a diastasis more common. Now, it doesn't mean just because you're pregnant, you're going to have a diastasis. A diastasis usually happens if somebody has already had some trauma to their connective tissue. Maybe they've done a lot of sit-ups, a lot of push-ups in the past, had a lot of coughing, sneezing, allergy type things where they pushed out, maybe have suffered from chronic constipation, or they've had consecutive pregnancies that have put repetitive pressure out on that, especially if one of those pregnancies had a prolonged pushing phase where there was a lot of holding the breath and bearing down. So any of those things can contribute to a diastasis while you're pregnant. Now that diastasis, as we know, decreases the integrity of your core. And it puts your abdominal wall, your entire abdominal wall, in a more weak position. So as the baby grows and the uterus gets bigger, if the abdominal wall is not strong and not connected, then the fetal alignment or the uterus can start to drop into this position, giving you a very torpedo-like belly and putting the baby's alignment in a different position. And we have some images that show this. We have an image where the belly is strong and the core is engaged and the baby is in an optimal fetal alignment where its head is down and the back is up. Okay, the other image shows with a weak core, the baby protruding out, the belly protruding out, and the baby's alignment, the head of the baby not being lined up with the cervix in a way that's going to be effective for delivery. Now that shows you specifically how it's going to affect delivery, but also it shows you how in your pregnancy that excessive pushing out of the belly from a weak core and a separated abdominal wall can put more pressure on the back because now your body has to compensate for that really forward pressure. That combined with not having good stability of the muscle around the spine can create some back pain, but also can make the diastasis worse because now we have even more pressure on that connective tissue. So trying to heal this and correct the core strength and to reverse the diastasis even while you're pregnant is totally possible and makes your pregnancy much more enjoyable and much less pain to endure throughout the kind of ebbs and flows of the months to come. The combination of that weak core and that diastasis can also affect labor because labor is it starts with the baby's head on the cervix, and if the baby's in a poor alignment, the head pressure on the cervix is less than optimal. That less than optimal pressure can cause labor to fail to progress, can stall out, and can have that really long days on days labor that just wears you out. So it's very important to get your core in a good alignment and good strength so the baby's in a good position so labor can go well. And then it goes right into the pushing. If the baby's in a less than optimal position, it has to be pushed around a corner to come out. Whereas if baby's lined up, the direct access to exit is a much better alignment. We also talk about having core strength for pushing. A lot of times the pushing stage is ineffective and people are coached to hold their breath and bear down for a long period of time, which that lack of oxygen affects the mom, makes them very fatigued, but also affects the baby and can lead to fetal distress. It's not the only cause of fetal distress, but if the baby's getting limited oxygen for hours, it makes it very difficult for them to be okay in the womb. So a lot of times, if we can teach people a more effective way of using their core and closing that diastasis so that they can have a better pushing strategy, we can decrease tearing, decrease fetal distress, and decrease the time of pushing so that the baby comes out a little bit better. Postpartum recovery is another part where diastasis can play a big a big role. If the baby comes out and you have a very separated abdominal wall and a weak core that was a result from your pregnancy that was never addressed, going into the postpartum birth recovery can be very difficult. There can be a lot of pain, a lot of weakness, excessive protruding tummy, but also an overall disconnect from these muscles that can contribute to postpartum anxiety and postpartum depression. Not to mention the weak core contributing to weak pelvic floor issues that can delay some of the healing that you really want to happen so that you can be mom and take care of the baby without having so much residual time to take care of your own healing. So not just treating the diastasis, but treating the whole entire core in your pregnancy can help so much with your overall experience during pregnancy, your labor, your delivery, birth, and birth recovery. So recognizing that diastasis is common in pregnancy, but is treatable during pregnancy and should be addressed while you're pregnant. All right, look at more of our details and this information that we have at thetummyteam.com. We would love to help you have a better pregnancy. Thanks so much.